We're standing at the cusp of radical transformation, harnessing artificial intelligence to revolutionize human health.
We live in a world today where we are generating data in almost every action that we take, whether it's developing documents, wearing a device that's capturing biometrics. All of those data can now be utilized to make life better.
We have one big integrated organization, which means that we can go from bench to bedside and back to bench pretty seamlessly. That's a special superpower for us that we don't want to lose sight of. There's a special hunger at this place to innovate, and this is really born from decades and decades of we will figure out a path forward.
We were the first academic medical center to establish a Department of Artificial Intelligence in Human Health, the first to give our students access to ChatGPT EDU, creating the nation's model for a true learning health system.
Hey ChatGPT, I'm trying to practice for my upcoming direct observation. Specifically, I have to do a mental health risk assessment on a patient. Could you help me practice this?
Sure, let's do it.
One question I asked is, what are the most common driver mutations of this gene? And I think that kind of helps me frame the context of what's novel about what we're exploring. It's really helpful for framing the question at the beginning and then exploring new tangents based on the data or the literature.
What differentiates Mount Sinai from all of the other health systems out there is the non-existent barriers between discovery, translation, and scaling. In doing that, we set an example for not just the rest of the country, but for the rest of the world.
With hundreds of use cases live today, AI is touching virtually every patient visit.
Hello, Robert. I'm Ava, your scheduling assistant. How can I assist you today?
With ambient voice technology, we reduce clinician note-taking and burnout, allowing providers to focus more on the patient. Our Clinical Command Center is a technology-driven hub where healthcare professionals use real-time data from across the health system to remotely monitor patients and facilitate timely interventions.
There's a set of time-sensitive emergencies where getting the information to the interventional team is critical for patients, like a really big stroke that causes severe disability. Patients' mortality literally escalates by the hour from the time of the incident to intervention.
Consider a recent case. A pregnant patient arrived with shortness of breath and chest pain. We ran an AI tool that flagged a tear in the aorta that demands emergency surgery. We took her straight to the OR. Both mother and baby did well, and today they're thriving.
The advancements in AI can actually pick up subtle differences of how the body parts move and how they correlate with each other, things that even an expert might not be able to pick up on. And it can be quite difficult to distinguish what is a random movement versus one that may be indicative of an issue like cerebral palsy or neurological dysfunction. So in this example, Mateo's hands are automatically tracked and quantified in terms of their pose, their mechanics, and most importantly, how it changes with movement. All these things can be tracked automatically.
This is the work happening now at Mount Sinai. And it means building this future together with the trust of our patients and the unwavering support of our community.
What excites me most about the future of AI at Mount Sinai is our ability to separate the hype from reality. We're really all about pragmatic innovation. What can AI do, and how do we get it to that point?
Over the next 5 years, we will see major changes. We will see ever more use of AI in biomedical research, improving our ability to take vast amounts of data and learn more about human disease, offering significant improvements in our ability to help a patient. And I also think artificial intelligence will help large hospital systems manage healthcare in far more efficient ways, and that will lead to a greatly improved patient experience.
Where I see the future of this going is that we have already genetic information on several 100,000 patients, soon to be over 1 million. We can create personalized medicine with predictive analytics, care standardization, and then the true promise of artificial intelligence, individualized care specific to your needs. It's wonderful to see Mount Sinai among the nation's leaders in adoption of artificial intelligence.
There are powerful tools across the diagnostic side, across the administrative side, across the therapeutic side that are really going to allow us to personalize medicine for each and every person that we interact with. And beyond there, beyond what that future holds, I would say that's a script still to be written. The folks here that are deeply committed to the patients, deeply committed to the communities that we serve, I trust them to craft that future for us.
From past to present to future, one truth endures. We do not just adapt to change, we lead it. And together, we will continue our mission to improve human health and reduce suffering, transforming the future for generations to come.